I have white spots on my upper lip, and what looks fat inside, and white spots on my gums. And what looks like a bite mark on the inside of my cheek. And the edge of my lips are burning, and my hair follicle looks like it's gray and clogged. And what looks like raised bumps 1 millimeter in the corners are burning, no ulcerations, and has been going on for 7 months. And I have stopped chewing tobacco for 1 year.
These answers are for informational purposes and do not replace a physician head-to-head visit. A patient-physician relationship is not established. Would it be possible to post a photograph? Thank you.
The last photo is the one with the raised bumps, and the white spots are under the skin. I think it's multiple problems, dental also, the beginnings of leukoplakia, all this cropped up after I quit chewing tobacco, and there is no ulcerations and it seems like it's just the hair follicles on the outside, they are inflamed, when I pull the hair out it's fine. My sinuses on my right side are swollen, I can't clear, that has been going on for a while now too. And the right side of my throat is tender on the outside. And sore in some spots.
Hi again. Nothing seems to be coming through, including my previous questions. Would you be able to forward a photograph or two? Thank you.
A customer 6TDP2F3Y says, 5:11 p.m. Full size image, full size image, full size image. 5:21 p.m. The last photo is the one with the raised bumps, and the white spots are under the skin. I think it's multiple problems, dental also, the beginnings of leukoplakia, all this cropped up after I quit chewing tobacco, and there is no ulcerations and it seems like it's just the hair follicles on the outside, they are inflamed, when I pull the hair out it's fine. My sinuses on my right side are swollen, I can't clear, that has been going on for a while now too. And the right side of my throat is tender on the outside. And sore in some spots.
How long have you had the pits at the hair follicles? I apologize for the delay, but I was doing research on your problem to see if I could tie in what I feel is leukoplakia with possibly follicular keratoderma. The latter is rare and is linked with a number of rare dermatologic entities. However, I could not find an association between the two. Nonetheless, I do feel you have leukoplakia. I would also be concerned that you might have verrucous leukoplakia with cutaneous involvement. My recommendations would be twofold. I would consult with a dermatologist and bring up that possibility. There was an article by Hood et al. In the Journal of the American Academy of Dermatology, 1999, Volume 41, 481-3. Also, I would recommend a course of Accutane, since this might help both problem. Proliferative verrucous leukoplakia is quite rare, although I did diagnose this in one of my patients about 15 years ago. You definitely do need treatment and close follow-up. Happy to answer further questions or clarifications.
All this has appeared over the past 6 to 8 months. I chewed a lot of gum. I also have had a problem with the tooth nerve, hopefully this will help with the root canal. I may have developed an abscess, filling pressing on nerve for 12 years. I think it's all interrelated somehow, one thing at a time. My sinus is involved also, thank you for the advice. I am seeing an ear, nose and throat doctor soon also. I had to reschedule for root canal. I am looking at pics for the leukoplakia and it looks a lot like it. Would an E. N T. Doctor be able to spot this also?
In fact, an ENT is an excellent choice to do a biopsy. It also seems that you have a chronic infection, perhaps with the nidus, local area of infection in the sinus. You might need a stronger antibiotic to clear this up. Sinus infections can linger and be difficult to treat. I am going to schedule a follow-up appointment with me for 3 weeks, and hopefully you can tell me then what the ENT doctor thought it was and the results of a biopsy.
I am still waiting for my appointment, and said it was clogged glands, no biopsy taken. My GP and I are leaning toward a bacterial infection. I have about 3 more months for the dermatology appointment.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.